Last month, 8 southeastern Wisconsin teenagers were hospitalized with lung damage doctors believe is related to vaping. One of those teens remains hospitalized.
And Local 5's Erinn Taylor spoke with one area doctor today about the risks associated with vaping.
We knew it was a matter of time before we're seeing it in the young teens, and it was a matter of time before we see a number of cases come together.
Doctors have watched e-cigarette use rise dramatically.
The numbers are staggering, and now 1 in 5, I think 20% of teenagers have used it. As a matter of fact, I had a conversation with my own teenager today about this issue.
The devices had been billed as a safer alternative to traditional cigarettes.
Cigarettes have been out for decades. We know a lot about cigarettes and what they can do to the human lung and to the human body.
And cigarettes have at least one thing in common with their electronic counterpart.
We're still getting a whopping dose of nicotine, which is it's a toxic chemical.
Toxic and addictive.
What we saw, based on the data that is published, is that it sounds like e-cigarettes are a gateway to actual cigarettes.
But it's what we don't know about e-cigarettes that worries doctors the most.
We really don't know what goes into these e-cigarettes, these cartridges. We're essentially putting chemicals into your body that we're not in full understanding of what they can do. To make things more complicated, these chemicals are heated by this device, and that alters their chemistry. It alters how your body reacts to them.
Dr. Al-Shahari says the unknowns add up to a high level of risk.
Why would you want to take a risk? What are you hoping to achieve? If your purpose is recreational and social, I think that's a conversation that parents need to have with their children.
In Green Bay, Erinn Taylor, Local 5 News.
And according to Children's Hospital, the 8 hospitalized teens have shown improvement with treatment, but the long-term effects are unknown.